Somehow, knee and hip issues are becoming more common, especially the knee with time, and hip also, uh, because we recently had the world had the major pandemic of COVID, and this COVID uh, time, we have been given by our physicians, various patients have been given by physicians the life saving drug called steroid to save their lives. But steroid has also given a side effect, that is the damage to the hip joint by causing avascular necrosis. So, a lot of our patients who were treated for COVID by steroids have resulted in having the problem of the hip joint. And these problems have been corrected very easily by various surgeries depending upon different stages of the disease, and sometimes in extreme cases the hip replacement, which is done successfully very well. I was fortunate to have operated upon our Nepal's the first lady and the former president, Madam Bhandari. And Madam Bhandari, when she decided about her surgery, she just took 30 seconds to decide. That once I told her that, Madam, you need the surgery, she decided in 30 seconds that yes, go ahead with the surgery. And fortunately, for last almost 10-12 years back, or probably 14 years back, we did the surgery. Madam is doing very well. So the joint replacements is a very successful surgery in today's time. In good hands, and any problem that patient has can be corrected very successfully. Interestingly, young patients as well as the old patients, like our patients have been, youngest patients have been 16 and 18 years because of the certain developmental deformities or congenital deformities of the hip and knee, have been operated by the knee replacement or a hip replacement, and they do very well for a long time. Similarly, patients who are as old as 94 have done very well. We have operated several patients who are around 85 or 87 by both knee replacement, and successfully so, without having any problem. So my thinking is that anybody who has a serious problem with his joints, especially the knee and hip, which are the weight bearing joints, needs correction, needs support. This support can be done in the form of the joint replacement for the knee or hip successfully under the expert advice, expert observation, and good hands. These days we have the best of the implants available that correct almost any problem. For example, for certain cancer cases, I have my patients who were operated for 10, 12, 15 years back for the total femur replacement, where the hip, thigh, and the knee, all this part was replaced. So that is also very successfully done. So that means that proves that majority of the problems can be dealt with if it is required, and safely so. And as far as the success of the surgery is concerned, no problem. The problems because of the surgery, side effects of the surgery have been minimized greatly. Like the pain after surgery is almost zero these days in my patients. We have done a lecture in the Nepal Orthopedic conference today morning, and my subject was how to do a successful knee replacement, and we have shown to our colleagues who are very learned that how to do a successful surgery without having the complications or side effects of the surgery. So today's surgery of the knee or hip can be totally pain-free without any need of the aggressive physiotherapy. Just the simple exercises will help in recovery. No sutures given, no complications, and minimal blood transfusion needed. So these are the best parts that we are fortunately enjoying the best part of the knee and hip replacement these days because of the better implants and better facilities, better surgical experience and training. So we our patients who need the help should use this help because this will be a life-changing time for them because having a disabled life reduces the life expectancy. So it is not right to keep suffering and keep delaying the surgery. When the patient needs it, it should be done. As far as the government is concerned, I'm sure that government is helping in so many ways for in every country. Probably the best role of any government could be in the encouraging the young surgeons for their training. For example, many young surgeons have come to me at my center to learn the art of the arthroplasty, and we are happy to support them. Similarly, the newer implants are available. I'm sure that they are available in Nepal too. They can be made available with the help of the government and supporting the education and availability probably is the best part that any government can provide to its citizens. And I'm sure that in Nepal it is happening because I can see that the growth is very good. Academic growth in Nepal is very good, very encouraging. Interesting part is that somehow bone diseases are increasing in magnitude and in the incidence percentage because of many reasons. For example, the poor nutrition is encouraging the obesity, and obesity is increasing the various problems of the knee and hip and also the back. The lack of exposure to the sun is reducing the vitamin D strength in the body. The low calcium, low protein intake, all these things they encourage osteoporosis or weakness of bones or osteomalacia, which is again another type of the weakness of the bone. So these problems probably are increasing with time. Smoking also is one of the issue that also causes osteoporosis and also avascular necrosis of the hip joint. So probably these things are increasing the incidence of the bony issues. Once the people are heavyweight and they are doing the lot of such activities like sitting on the floor or doing the treadmill, interestingly, can be a small problem in patients, in people who are having the knee issues. For such people, probably it is better not to do the treadmill. If you have a knee issue, cycling is a very good exercise, swimming is a very good exercise. So coming back to why the bone diseases are increasing in recent time, the nutrition could be one of the reason, the lack of activity could be another, and following the wrong kind of activities. If some young person is going to the gym, maybe the wrong activities at the gym can also be the reason for the problem. So suddenly trying to lift a very heavy weight is not a good idea. So probably these are the issues which should be dealt with.
Thank you. Thank you.